My name is Tashina and welcome to CAPRI. My role here at the clinic is to help you get in to see our doctors as quickly as possible. There are a few things that I will need from you in order to do that. The first thing is on our website at capriclinic.ca we have an intake form that we will ask you to fill out, and that's just some basic medical history that will help determine if you're a candidate for the treatments that we provide here. And then once we receive your intake form along with the referral and the most recent imaging reports from every area that you would like us to assess, I will call you to schedule an appointment.
We focus on areas of muscle, bone, and joint disease. So it's what we call musculoskeletal disease. And it's a very common problem in our society. People play hard when they're young and get injured. They work hard. We're seeing mostly people whose joints are wearing out. Osteoarthritis or wear and tear arthritis. People with chronic tendon problems, tendonitis. And the reality of the situation is, as a population, we're getting older. So normally there's areas that get injured, and when we're young we're able to repair them. As we get older, that balance of injury and then repair becomes imbalanced, and pretty soon these injuries become chronic and we degenerate. There's an exciting area of medicine called regenerative medicine that has emerged recently, where instead of just controlling the pain, we're trying to put medication, actually the body's own cells, into the area to re-stimulate that healing stimulus, to tell the body there's an area that needs to be focused on to try to regenerate or heal. These regenerative therapies include putting in cells like platelets from the blood, or more powerfully, stem cells from either bone marrow or fat or wherever we can derive the stem cells. And that can re-trigger a healing response in the body.
When we take stem cells and put them into an area of chronic disease, these stem cells can change into any body tissue, such as bone or cartilage or muscle or tendon. They actually are signaling cells that signal various other cells in the body to actually start healing. Stem cells can be found in almost all body tissues, but they are particularly abundant in fat and bone marrow. It's important to know that our therapy depends on stimulating the body's own healing process, and therefore it will take time. We don't determine whether the treatment has been successful for at least 3 to 6 months.
We are very carefully following the outcomes to see how people do. We're using a questionnaire that analyzes 3 things: pain, how severe it is, how frequently it's there, how it disables you in activities that are important to you, and also how it affects the quality of your life. So we follow people throughout a year, and what we found so far is that at approximately 3 months after the injection, they have lost about 1/3 of their pain. By 6 months, they've lost approximately 2/3 or 3/4 of their pain. It doesn't work for everybody. There's about 10 to 15% of people, unfortunately, that do not feel improved after the injections, but they aren't feeling any worse. There are some conditions that aren't designed to be treated by regenerative injections. If you have an inflammation type of arthritis, such as rheumatoid arthritis, where the body's attacking its own joints, or if you have an inflammation arthritis because there's gout crystals building up in your joint, so you have gout arthritis, it's not going to work for that. Also, it's important to know if you have an infection, either at the joint we're going to inject or a general infection where you have fever and chills, that's not a time to have an injection. And if you have had cancer that is still active, or you've had cancer that's been treated recently, we would not want to do any stem cell injections with you, as the stem cells stimulate reproduction of cells in your body and could trigger an activation of the cancer.
When you come in, we do a very thorough clinical interview. We need to find out if you're taking medications or if you have conditions that might get in the way of your healing. Then after the interview, we do an orthopedic exam. So we're looking at the joint that you want treated, at joints above or below it, just making sure that there are not other things involved that might get in the way of your recovery. You know, we understand that people are spending a lot of hard-earned money on this procedure, and it's really important to us that when they come in, that we are providing treatment to the structure or structures that really need it. A lot of times the procedure is pretty simple. It's just a knee or a hip, but in other cases the process can become more complicated when other joints or structures become involved that the patient may not have been aware of.
At the CAPRI Clinic, we work here as a team. We have a variety of different specialists here, a variety of different disciplines. We have an exercise therapist to help with the lifestyle, particularly the exercise component. We have a chiropractor who helps us with the assessment of the muscle, bone, and joint status of the spine and other joints. We have family doctors that can help us with the assessment of the general medical condition that will optimize the healing process. And then we have specialists who can administer the stem cell and other regenerative therapies to the exact target spot through imaging like ultrasound or x-ray.
So now that you know a little bit more about the services we provide here, if you feel that any of them will be beneficial to you, we invite you to visit our website. And if you have any further questions beyond that, we'd love to hear from you.